has no cure, but it can be prevented. Ebola, Ebola, let's fight it together. Let's fight it together. Ebola, Ebola, let's protect ourselves, our family, and our nation.
Tell everyone you meet about Ebola, so that they can be well informed. Anyone suffering from Ebola, for the nearest health center or hospital.
My people will know our tradition. When our people then die, we want to go near them, we won't hold them, we won't bathe them, we won't plait their hair. But this time today in Liberia, that rough time on also. You know what I mean by that? That emergency. So the Ebola sickness, when you see somebody die today, all the nurses and doctors, let them bury the person to protect yourself, your family, and your community. All the traditional leaders join on board. Let's tell the people about this Ebola sickness. It is no joke. Ebola can kill. Denial will kill plenty people, but protection will save a lot of people. Let us protect ourselves and our nation.
Ebola is real. Let's protect ourselves and our family. Ebola can kill. It has no cure, but it can be prevented. Ebola, Ebola, let's fight it together. Let's fight it together. Ebola, Ebola, let's protect ourselves, our family, and our nation.
Tell everyone you meet about Ebola, so that they can be well informed. Anyone suffering from Ebola, for the nearest health center or hospital.
My people will know our tradition. When our people then die, we want to go near them, we won't hold them, we won't bathe them, we won't plait their hair. But this time today in Liberia,
this is Tubman University Public and Media Relations. We are sitting with the team of the William V.S. Tubman Ebola Task Force in the presence of the chair of the task force, Professor Iona Thomas Corner. Professor Corner, welcome to Tubman University Media Web TV.
Thank you.
Professor Moba Toba, welcome. Thank you. Professor William Harris, welcome.
Thank you.
Mr. Hilary To, our physician assistant, welcome.
Thank you.
Professor Corner, how has the university responded since the outbreak of the Ebola virus disease in Liberia?
The university has been very proactive in the response to the Ebola crisis. Since way back in March, our president, Dr. Davis Russell, had the foresight to see that education was the priority. And as a result, she commanded the College of Health Science and the faculty of both the public health and the nursing program to organize an awareness session workshop, which we did for all of the TU community. And the public health department then charged their students to go out and do awareness activity in the community. That was way back at the very first outbreak in April. Mr. Tubman, who was here, was one of those who participated in that, organizing that seminar. We then, the university then had its graduation, of course, and we went on a break and went into, the task force was formed. And since the the forming of that task force, we have been very active working in a collaborative manner with the county health team, with the Maryland County Task Force in providing technical support and doing our own on-campus awareness activity.
Since the establishment of the William V.S. Tubman University Ebola Task Force, could you tell us some of your achievements so far?
The achievements of the task force has been many since its formation. We have engaged in awareness and prevention education by partnering with 2 of the local community-based organizations, AGPN, which is Adolescent Girls Protection Network, and Justice and Peace, JPC, in targeting 12 communities that house our students and our faculty and staff in both Plebo City and Harper City, where we collaborate these 2 groups to go out and do active awareness in those 12 communities, 7 in Harper District and 5 in Plebo District. During those awareness activity, we also supplied our collaborators, our partners, with bleach, soap, and hand washing containers to be distributed to key sites within the 12 communities. We monitored the activities to ensure that awareness activity went on and that the people were getting or implementing those things they learned. We also targeted our specific communities, such as Grand Kavala, which is one of our communities that we have adopted over the past 4 or 5 years, and provided them with the same supplies. Working in collaboration with the county health team, we worked with IRC, which is International Rescue Committee, and with Dr. Abibi in doing training for 113 community health volunteers on Ebola awareness and prevention. What that is those of the community volunteers are in the community. They're the eyes and ears of the community as it relates to health promotion. So they were the first targeted group that Tubman University collaborated with to try to make sure the community would be well prepared in case there's an Ebola outbreak in their respective community.
Dr. Odell Tubman, County Health Officer of Maryland County, recently described Tubman University Ebola Task Force as a strong partner. Could you tell us more about that partnership?
Tubman University, yes, is indeed a very strong partner with the Maryland County Health Team and the Maryland County Task Force. We serve on 3 committees. The first committee is the Awareness and Prevention Education Committee, which is a social mobilization committee, and we're very active in helping from an educational standpoint of view to prepare partners of the county health team and the county to go out and do active awareness. We also serve on the media and public relation, which my colleague here, Otto Gaye, is the chair of that. And we do a lot of publicity and activity. We serve on the Monitoring and Evaluation Committee, and where we go out to monitor and evaluate the work of Ebola activity in the county. We are also actively involved in fundraising activities with our partner, with Tubman University, and the county's partners oversee. One of them is MFP, which is the Marylander for Progress and the Marylander Reunion group that have been supportive of activities here in the county by their donation of thermometers and other preventive items.
Professor Connor and members of the task force, what are some of the challenges you are faced with?
That's a tough question because there are many gaps and challenges. The first key gap I would say to you is the funding. getting funding to support activities, the awareness and prevention activities, to buy bleach, to buy the buckets, and to buy the faucets that gets attached to the buckets, to incentivize mobilizers to go out and do the work in earnest. That's the key. The next gap is feeling secure about the availability of health services other than Ebola respond, so that we can focus on Ebola. And so the availability of a good lab, the availability of transportation if you get sick, say, via an ambulance is a gap that we feel needs to be here. We have a clinic at Tubman University, and having that clinic well supported in providing health services to me is a gap in fighting Ebola. Because if we have that, then the focus is truly on Ebola, because the clinic will be able to focus on helping us keep healthy. And not only the clinic at Tubman University, but in the county.
Professor Conner, could you please tell us who are your major donors and contributors?
When you ask about who are our major donors and collaborators, I would have to first say the members of the task force. These men and women have really given up their time in this crisis to volunteer to serve and to serve TU and to serve the county in the fight against Ebola. When we come to donors in relationship to finances and items and resource, I would say Marylander for Progress outshines all, as well as the National Association for Negro Business and Professional Women Club Incorporated, which is both located in the U.S. They have given us items, funding that has enabled the task force to continue its work. Marylander for Progress has provided us with support in relationship to thermometers, the electronic special no-touch thermometers. They've given us wipes and gloves, and have continued and also donated funds to help us purchase materials for the hand hygiene promotion activities and our awareness. The National Association of Negro Business and Professional Women have supported our 10 nursing graduates by paying for their licensure fee so that they can replace and participate in replacing many of the healthcare workers that have passed as a result of Ebola. So we, I believe, have been blessed with the kind of support. We still need more, though. In addition to that, our own employees, led by Professor William Harris, has raised funds out of their own personal pocket to support the daily upkeep of the operation of the task force. And for that, we believe that we take care of our own first, and it speaks volume to Tubman University fight with the county health team and the county task force against this deadly virus.
Professor Conner, this interview is about to end. Any last word?
As this interview comes to an end, I would like to address the viewing audience of this interview. The fight against Ebola takes all of us. Tubman University is just one partner in this battle. I would ask that you continue to support us in your finance donation, in your prayers. And I'd ask also that you understand that the fight does not just begin or end with Ebola, but it starts after post-Ebola. And I would ask that you look to continue to support the university in helping further good health in Maryland County by donating and adopting our hospital, our regional hospital, and our clinic on campus. I'd like to also take this opportunity to let you know that this task force could not function without the commitment of this, what I would call the servant leadership of the members on the task force. And I would like to give a good shout out, as we would say, to those members to continue to do what they do, given the situation, the stress that it takes to work in excellence under such constraint and such difficult time. I thank you for the opportunity to participate in this interview, and I thank my colleagues who have supported this process and their commitment. Professor Tubman, who is the chair of the Department of Public Health, Mr. Hilary Toe, who is the physician assistant in our clinic, and the able gentleman that you see there, Professor Bill Harris, is our fundraiser champion and chair of the secondary education here at Tubman University.
Thank you very much.
Thank you.
Ebola is real. Let's protect ourselves and our family. Ebola can kill. It has no cure.